we have our next speaker amongst us, the distinguished personality in the field of yoga and naturopathy, Dr. Nagalakshmi ma'am. Post her naturopathy, she did her PG diploma in hospital and healthcare management with MA in philosophy. Currently, she is working as administrator and finance officer at Indian Institute of Health and Family Welfare, Hyderabad. She had been working as senior medical officer, associate professor at Nature Cure Hospital, Government of Telangana. She has 30 years of clinical experience and 15 years of teaching experience and has also worked for 2 years in cancer management. I welcome you, ma'am. Today, she'll be sharing her expert knowledge on principles of health and wellness in Patanjali's Yoga Sutras. Dr. Nagalakshmi. Ma'am, you are muted. Your voice is not audible. Unmute yourself. Am I audible, ma'am? Yeah.
Thank you. Okay. Good evening. Thank you very much. Thanks for the opportunity and all the best. Let me directly, because time is very short, let me go to my topic. Yeah. See, the principles of health and wellness in Patanjali Yoga Sutras. As we all know, Yoga Sutra, these Patanjali Yoga Sutras are coded maybe 400 BC. And this was written for their contemporary, based on their contemporary issues maybe, but applicable even today and maybe after 100 years. Because they are all principles, they are not any shrutas. So let us know the difference between health and wellness. See, health is being, like we are born healthy, okay? And maintaining wellness is by choice. So you can have good lifestyle practices to stay healthy and retain whatever the health you got from your, right from your birth, or you can lose it. It is by choice. Then let us understand the definition of the very definition of health. As per the World Health Organization, it is having balance between physical, mental, and social well-being, not mere absence of disease. But how does a naturopathy and yoga field take it? So yoga, naturopathy field takes it physical, moral, as well as spiritual well-being is called health. So these Patanjali Yoga Sutras are made a perfect balance between the ecosystem and human being by giving these moral and spiritual planes. As we all understand that, being spiritual is not only respecting humans, but respecting complete ecosystem. Yoga accepts Sankhya philosophy as it is, as a theory, and Sankhya and yoga is the practice of whatever been taught in Sankhya. So Patanjali has not addressed any contemporary health issues or disease issues. He has addressed an individual taking as a unit in the society, and he has addressed entire society taking human as an individual unit. So by looking at this, there is a combination of things where Rajasic activity will act as Rajoguna acts as a catalyst between tamasic organs and tamasic part of our constitution, as well as sattvic part of our constitution, then work together and to get the impressions through manas, which is a filter, which gives to pains and pleasures. And by using our intelligence, we can get rid from our whatever the imprints, whether it is painful or pleasureful, as the very definition of yoga says. Let us understand. See, for so you can see this slide where we talk about being sattvic. There is nothing called the state of sattvic alone, or eating or practicing something sattvic alone will get the balance in body. We have to have a perfect balance between sattva, raja, tamo gunas in our body to maintain our health or maintain the state of well-being and repair our disease condition. That's why we call balanced diet or balanced thoughts. So any organ will have to function with by nature, by constitution. Karmendriyas and Jnanendriyas are sattvic, whereas the very tanmatras or ability of the sensory impulses and panchamahabhutas, they are tamasic, and together with combination through rajoguna, we get impressions or work done. And all these 11 organs are called Ekadeshendriya, through which the afferent and efferent neurons will work. Yoga chitta vritti nirodha means the yoga is a cessation of modifications of mind. Then what is this chitta? Chitta can be used as, chitta is used as noun as well as verb. And chitta has got different facets, means angles like in diamond, and it has got 5 states. So every person will have these 5 states where each guna will work. Then what way this is related to health? Because as we seen in the earlier slide, the sensory organs or it and its tanmatras play a major role in giving or maintain the status of mind. So to understand that, to clean that, we have to understand the states of chitta to have better control or optimum utilization of jnanendriyas and karmendriyas. So in the reference, we have to limit ourselves in the principles of health in Patanjali Yoga Sutras. So these 3 are the issues we get in practice of yoga, or Patanjali has given these 3 sets of or hindrances or issues through our practices, whereby by having control over these, we can retain our health or repair our disease. So vrittis are all for intellectual issues. Means pramana, viparyaya, vikalpa, nidra, smriti. These are 5 vrittis. They may be painful or pleasureful. So vrittaya, panchataya, klishta, klishta. Means these are the impressions which give pleasure or pain. So if you have a discriminatory capacity to control these 5 vrittis at intellectual plane, we can have better balance in our intellectual utilization of our energies. Next comes to emotional issues. There are avidya, asmita, raga, dvesha, abhinivesha. Dr. Satyalakshmi ma'am has already dealt with abhinivesha, means fear of loss. So These are emotional, 5 kleshas. Avidya means simple ignorance. So though we will have knowledge, but we might not have trust, or we will not use it, or use it as a, uh, we will lose interest in insights of that, is avidya. They're better described in textbooks. Then asmita. Asmita is the identification of identification with oneness. If we go back to our Sankhya, because yoga accepts Sankhya as a theory. See, this I-ness is ahankara. Ahankara, though we use it as a negative term, but ahankara is a is the self, or the Vishesha Tattva of uh, any creature. I cannot limit myself to even human, because in Vaiseshika Darshana, the Vishesha Tattva of anything, for an example, a fruit, an apple has got, apple is a fruit, it has got its own Vishesha Tattva, and neem fruit is also a fruit which is bitter in taste when it is raw, and it gives a different flavor when it is fruitified. Like that, the Vishesha Tattva is the identification of Asmita, means me. So one shouldn't follow with the Vishesha Tattva of anything, and we have to follow the commonality. So recognizing oneself with its Vishesha Tattva is the biggest mistake we practice in our life. For an example, if a rich person, or if somebody identifies himself or herself with whatever the procurements they have or possessions they have, that is the identification. Or some people will have a will identify themselves with a possession of degrees. It is again a tamoguna. Like that, we have to avoid identification with I-ness. That is the biggest. It comes through avidya. So because of avidya, we practice asmita. So with the asmita, because of the impressions of pleasure and pain, so sukhanashayi ragaha, dukhanashayi dveshaha, means if you have any pleasureful memories, we will have affinity towards that. And if you have any painful memory, we will completely differ from that. So if you the biggest issue is the ignorance or avidya. So when we stop, when we develop discriminatory capacity in our daily lives, that will lead us to be away from our asmita, and we will be out from raga and dvesha. So then ultimately the fifth klesha is abhinivesha, the fear of loss. So when we have fear of loss, we get attached to something. So when we get attached to something, it gives us parigraha, whatever is described in Ashtanga Yoga and Yamaniyamas, all things will be practiced when we have the fear of loss. So to avoid these kleshas, the Ashtanga Yoga is being described. So then let us get back to this side. Then there are certain environmental issues like called chitta vikshepas, the pravartana, means the environment, the society. These chitta vikshepas are basically 9. Vyadhi, the illness, and sthana, languor, means procrastination, and samshaya, doubt, pramada, negligence, and alasya, laziness, and avirati, lack of detachment. Then bhranti darshana, hallucination kind of thing. Then alabdha bhumikatva, not attaining the stability. Then anavastatvani, Then instability. So alabdhi bhumikatva means if you're not getting anything, we will have a strong feeling. So these things, these 9 chitta vikshepas will give dukkha, means the suffering, daurmanasya, despair, angame jayatva, uncleanliness. You can just immediately you can relate to any schizophrenia case. Then swasa prashwasa, swasha and prashwasa. So any of these practice chitta vikshepa will change the breathing pattern. So these 3 things are described as unhealthy or to be avoided in Patanjali Yoga Sutras to avoid disease or to avoid disease, yes, to avoid afflictions. This chitta vrittis. So though Patanjali has not given anything like in Hatha Yoga Pratipika and Gedinda Samhita, if you practice this pose, sorry, if you practice this pranayama or you practice this mudra, this bandha, you can avoid this XYZ disease or any pain. Patanjali has, because it is a spiritual science, Patanjali has given these 3 things to avoid the deviation of our practices, or and he has termed it as unhealthy practices. We can call it as unhealthy practices. Then how to do it? Because earlier we thought yoga chitta vritti nirodha. Then how do you avoid all these 3 things? Abhyasa vairagyabhyam tannirodha means the practice and renunciation will make us realize or have a discriminatory capacity to understand these chitta vrittis and chitta vikshepas and kleshas and come out from them. Then how to do abhyasa or practice? So to practice, we have to have 4 things. The trust. First, we have to have a trust in our practice. For an example, somebody wants to do fasting. So first, they have to have a trust on that philosophy of fasting to practice that. Otherwise, that will not give you any result. Then vigor. You have to be very strong in to have to do that particular practice. Then we have to have keen memory of in whatever we are doing. For an example, we learn tables in our primary school. So we do repeating. When you come to practice, there are 3 things: smarana, manana, and nididhyasana. These 3 things will make our action perfect. So we have to learn, repeat, and you have to recollect from memory. That's why we do everything and anything 3 times so that it gets imprinted in our memory. So we have to have a keen memory to have our abhyasa. That is why we practice cleanliness in our niyamas. Then we have to have confidence in whatever we are doing. So if you don't have confidence in what we are doing, then we will lose our focus and end up in misery. So because again I'm telling you, because these are all spiritual practices, we will not talk about disease. We only talk about what will happen good if you practice these things. Then we have to have, then how to, so any practitioner should have some certain attitudes. So these are the 4 attitudes: Maitri, Karuna, Mudita, Upekshana. So the and Sukha Dukkha, Punya, Viseshanam means these 4 things will give us Sukha Dukkha, Punya, discrimination. So Maitri, you have to have a cultivate a friendly attitude. You have to have a friendly attitude to do anything or to practice anything. Then you have to have helpfulness, karuna, in you as your attitude towards your learning. Then you have to have conviction, then upeksha. So when you have these 4 attitudes, your abhyasa will be perfect. Because only when you practice these things, then we can say that the prayatna shaitilyanantara samapatibhyam. Then our prayatna means the initiation and our end or end result will club together only when you have a strict practices, or these you have these learning attitudes, and then you have these 4 ways of doing. Then only you have Drida Bhumi. Then the impact will be on the 7 planes of human. So these 7 planes or the Sapta Koshas. So Annamaya Kosha, which is a physical in nature, and Pranamaya Kosha is a physiological, Manomaya Kosha is psychological, and Vijnanamaya Kosha in intellectual, and Anandamaya Kosha joyful, and Chitta is the pure consciousness. Then comes to Atmamaya. See, in our clinical practices, we can observe that disease does not come with simple imbalance in what we eat or what you do. Because normally we try to correct many things by correcting our Annamaya Kosha. There are certain diseases which actually starts from any imbalance even in Anandamaya Kosha. So we will be surprised to see the person is eating well and all other parameters are perfect, and even in psychological plane, the person is very, very, very well. However, he or she end up in misery, because we understand yoga and naturopathy understand the moral and ethical or moral and spiritual planes of being is very important. That's why we have to analyze a patient as per the koshas. So we have to understand these koshas and where the imbalance has happened, so that we can retain our status of health. That's why when you do these abhyasas or have a renunciation practices, abhyasa and vairagya, the impact will be in such a deep level. Then comes to the practices. Because as a grossly when you observe, we will think only these are the 8 practices Patanjali has given to keep up our health. Yamas, niyamas play major role to have other 6 limbs. That's why it is given in the beginning. Yamas, ahimsa. So what is ahimsa? Ahimsa is not just what we practice any tattva now. Ahimsa, himsa. We have to understand what is himsa. So himsa is generated through greed and anger. In any mild, moderate or intense degrees will lead to avidya, which in turn lead to violence, which gives pain and ignorance, which can be avoided only through introspection. That is why yama niyamas are playing major role, and ahimsa is given the first preference. Then comes to satya. Satya is the one who follows the satya marga, one who stands for the truth. Because though change is constant, but truth is same. Then asteya, non-stealing. Stealing in many levels, maybe physical level, maybe energy level, or maybe intellectual level. So we have to have certain practices or what we call certain practices to give credit to what you call not give credit to which give doesn't belong to us. It is the simple practice is you give credit to cleanliness in your office. This is a simple thing I'm telling. Cleanliness in office to your janitor. This is the simplest practice. I'm talking in very physical level. This is the simplest example. Then aparigraha. So don't own anything which doesn't belong to us. So we shouldn't keep anything doesn't belong to us. It may be physical, what you call, it may be physical or it may be at any level. So non-greedy means, not to have possessions. So we will have possessions of our attainments of our graduation or kind of what you call, okay, I'm finishing. Graduation or our certificates or the wealth we own, all these things we have to have a capacity to disown, give credit to the something else. Then brahmacharya, we shouldn't have what do you call the ultimate attraction is celibacy, sorry, sensual attraction. So with which we lose lot of energy through shukra. So we have, when you have a sensual attraction, the most of our energy, the vitality will be losing for the attraction. So once you have to have a very clear practices. Then niyamas, so saucham, santosham, tapas, swadhyaya and ishvara pranidhana. So when you have the guts to practice these yamas, niyamas are already practice in practice. So that's how we have to, these 8 limbs are interdependent and complementary to each other to have, we can name it as a healthy practices. And these Ashtanga yogas are these 8 and Pratyahara is the bridge between these two. The first Yama, Niyama, Asana, Pranayama are cleaning practices, whereas the Samyama, the Dharana, Dhyana, Samadhi is a building up of our personality practices. So once, until and unless we are thorough with our physical practices, Bahiranga Yoga, and through Pratyahara, we can reach the Samyama. And the Samyama, when you are able to apply in different planes of our life, and one can have health as described or as defined in yoga and naturopathy textbooks. And Patanjali has given a beautiful phrase how to respect our body. So Rupa, Lavanya, Bala, Vajra, these are the things. The perfection of body includes beauty, graceful, strength, and adamantine hardness. So once when you practice these things, then we have body with these qualities, because we are dealing with day-to-day health issues. So we have to have, so by practicing these things, have healthy body. Thank you very much for giving me this opportunity. And it is very difficult to convert 196 sutras into half an hour topic. Thank you very much. I could able to pick up only from 2 padas. Thank you.
Very well explained, ma'am. There is one question from the participant.
Yes, please.
The question is that, is it really possible to follow Ashtanga Yoga in day-to-day life?
Yeah, sure. Why not? It is able to, we can follow.
We can follow.
Yeah, see, once you have to have, the very basic thing is you love yourself. First, the loving self will give you the way to practice Ashtanga Yoga.
Okay. It said, like you very well said, that you should not practice to have a good practice. Regular practice is not necessary to have a good practice, but instead to keep steadiness within ourselves. Once we are steady in and out, definitely we are going to have the optimum state of health and wellness.
Yeah.
Very nicely you explained the principles, how they can help us to be healthy in our day-to-day life. Thank you, ma'am,
Thank you
for
very
your
much.
informative session and your invaluable time.
Thank you.
Thanks a lot. Now, moving ahead, we have our next speaker amongst us. It said, leadership is not about a title or designation. It's about the impact, influence, and inspiration. Amongst us is such a leader as our next speaker, under whose aegis Government of Tamil Nadu has established various new initiatives which have made yoga and naturopathy available in all the districts of Tamil Nadu. His work during COVID-19 pandemic is well appreciated as a role model and has been adapted by all states across the India. Yes, he's none other than Professor Dr. Manavalan N. Principal, Government Yoga and Naturopathy Medical College, Chennai. Joint Director, Yoga and Naturopathy, Directorate of Indian Medicine, Government of Tamil Nadu. I welcome you, sir. Today, he'll be enlightening us on integration of yoga and naturopathic medicine in public health system. Dr. Manavalan N.
Good evening.
Good evening, sir.
Am I audible? Okay.
Sir.
Yeah. First of all, I must thank our college management and organizers, and for giving me this opportunity to present to our colleagues and our friends, yoga naturopathy community and public. So this is the integration of yoga naturopathic medicine into public health system. So it's a really very important area and very important time where we need to focus more on public health so that a large number of population can be used in health sector. So next slide, please. Someone can, yeah. See, basically for any type of intervention in public health system, we need basic infrastructure that is a basically human resource. That's more important, because as you know, the public health system is a very, very strong healthcare provider for almost the entire populations, either 1 or 2 times minimum. So if you take like that, here in the state of Tamil Nadu, we have starting from primary health center. Before that, there is a health sub center in village level, and primary health center, and taluk hospital, non-taluk hospital, district headquarters hospital, then medical college hospital. Then we do have multi-super specialty hospital. So these are the healthcare setup in Tamil Nadu. So in that, we would like to introduce our yoga naturopathy system of medicine in public health system. That means in each centers, starting from primary health center to multi-super specialty hospitals. So basically, I remember in government of Tamil Nadu encouraged yoga naturopathy system of medicine long back in the year 1997, where first unit was started. Yoga naturopathy clinic was started. Then after 3 years development, we could able to start government yoga naturopathy medical college and hospital in the year 2000. For any development in public health, we need human resource. Until unless if we don't have a qualified human resource to provide quality treatment, it's very difficult to implement. So that on that vision in the year 2000, there was a government yoga naturopathy medical college and hospital. Apart from private yoga naturopathy medical college was started in Tamil Nadu in the year 96. So we could able to slowly, we could able to improve create the qualified human resource in the field of yoga naturopathy medicine. That we know, all of us know that there is a BNYS, medical degree course, Bachelor of Naturopathy and Yogic Science. 5.5 years course was started. Then we could able to bring out qualified yoga naturopathy doctors. Slowly, we want to utilize their services in public health system. Then in the year 2009, we could able to enter into the primary health centers. So that was a primary health center where we could enter with the qualified yoga naturopathy doctors. We have started each district one, that is around 20 centers we could able to start. And each center was providing treatment for almost average of 80 to 100 patients. There's a footfall per day. Based on the development, then slowly 2011, we could able to start each district one primary health center. There is a block PHC. There's a main primary health center in each district one. That time we had 31 districts. So in 31 districts, each district one block PHC. That is a main primary health center. There is 24 hours primary health center. There we have started yoga naturopathy maternity clinic to provide easy delivery, normal delivery, and very good health care for antenatal care, postnatal care, during delivery time, how to assist the pregnant ladies by our qualified yoga naturopathy BNOS doctors. So we could able to start 31 centers, each district one. So that has given very good result, not only for pregnant ladies, pregnant mothers, and apart from that, they could able to concentrate on NCDs, non-communicable diseases. As you know, the non-communicable diseases is alarming issue now in India, worldwide we can say, like diabetes mellitus, hypertension, obesity, cardiac diseases, cancer, and number of stress is one of the main. That is also mental health. So all these issues we need to take care with our yoga naturopathy system of medicine by providing quality lifestyle medicine. So basically, yoga naturopathy system of medicine can do holistic approach. In all 360-degree angle, if health is taken, our system can play major role in all directions. That is a 360-degree directions. So based on that, we could able to teach pregnant mothers and have natural delivery and create healthy society from the mother's baby and till the end of life, geriatric care, and all areas wherever the health issues arises for preventive, promotive, and curative aspects. So that was the yoga naturopathy maternity clinic. Then in the year 2013, based on our development in Tamil Nadu, more number of colleges have come up. There is a BNYS medical degree course, yoga naturopathy medical colleges and hospital has come up, and we had a number of qualified doctors. We have increased the human resource availability. Based on human resource availability, at the same time, we need to reach interior level, rural area, and other hospitals. So in the 2013, we have started yoga naturopathy lifestyle clinic. See, basically, this is the name, yoga naturopathy lifestyle clinic was coined, and see, we can play the major role in lifestyle, control NCD, non-communicable diseases, lifestyle disorders. So we have started this yoga naturopathy lifestyle clinic in public health, Taluk Hospital, and district headquarters hospitals, and medical college hospital. We have 21 allopathic medical college hospitals. So all allopathic medical college hospitals, we have yoga naturopathy lifestyle clinic, where our BNYS doctors are appointed and therapists are appointed and a hospital worker. and they are giving treatments to the patients, all types of patients, starting from non-communicable diseases, lifestyle disorders, mental health, pregnant women, children, of course, all other geriatric problems. Then, apart from medical college hospitals, we have started multi-super specialty hospital. So we had one multi-super specialty hospital where we have different departments: oncology, cardiology, and neurology. It is super specialty hospital where we employed 3 BNOS doctors. It's all regular doctors, regular scale, regular doctors, so that 365 days the medical facilities, the treatment facilities will be available to the patients. So this is the bubbly health setup in Tamil Nadu, where we have 177 centers. Then there was one government college in 2000, and recently, based on the demand, based on the requirement, and to develop furthermore in research activities, we have started International Institute of Yoga and Naturopathy Medical Sciences with a 300-bedded hospital and 100 BNYS students and 30 PG MD courses in 50 acres of land. So it's being established. So outpatient department started functioning and patients are seeing, and this year admission process will be going on. So this is the motivation of Government of Tamil Nadu to yoga and natural system of medicine. This is overall bubbly health system, how it functions. And last year, especially last year, all these centers, 177, 178 centers in Tamil Nadu, could able to treat nearly more than 46 lakhs patients, 46 lakhs footfall entering to the yoga and naturopathy clinics, centers, hospitals, and visiting our BNOS doctors, having consultation and treatment. This is the health systems. So research paper also published in Public Health, which I will show later on. Next slide, please. So this is where I already explained you the maternity clinics, wellness centers, and they recently, if you go back the slide, I missed one point. Please go back slide. Yes. Here, recently, there's a National Ayush Mission was introduced in the year 2015-16. From that time, we have started yoga and naturopathy wellness centers. So yoga and naturopathy wellness centers, about 34 centers. So there we treat all kinds of patients, including pregnant mothers. Next slide, please. Now you are able to see all our activities. See, this is the real-time activities. This is the real time, every day. See, it's not that we do yoga 1 day or 2 days. Not like that. This is a 365 days. There will be availability of facilities in public health. Yoga naturopathy facilities, yoga doctor will attend, and the therapist will attend the patient by giving treatment based on the doctor's prescription, and hospital worker will maintain the hygiene, cleanliness. So this is the setup in each center. So what you are seeing here is ANC mothers, antenatal care. See, almost the acceptability among the pregnant ladies is very high, because the main target is now today for pregnant ladies, there must be some physical activity. That means yoga program for antenatal mother, and dietary herbal supplements. You see, today anemia is a major role in public health. Even after 50 years of very severe intervention in public health, we could not come out successfully for anemia patients. Even now, the maternal mortality rate is going on because the death of pregnant woman is taking place. Its main cause is, one cause of death is anemia. Their HB level, if you check, will be around 6, 7. So during that time, our natural diet, natural dietary supplement, and natural herbal supplements, pure honey and moringa leaves. You might have seen that moringa leaves is a rich source of iron and rich source of potassium, and like that curry leaves and amla. So all these combinations is being supplemented to the pregnant mothers adolescent girls, and through our yoga naturopathy doctor in all yoga naturopathy clinics to take care of anemia. Apart from anemia, you know very well that hypertension. You know the eclampsia, we all study in obstetric gynecology. See, one beauty is I must congratulate all our yoga naturopathy fraternity and doctors. The beauty is our curriculum, our syllabus, our training, our course, which covers almost 360-degree angle. My BNOS doctor can talk any subject, any topic, any work which is related to public health and overall holistic health care provider. That's why we could able to enter maternity ward, because he has studied obstetric gynecology. He can assist the labor. He can help for the pregnant ladies. So based on that, in each and every area, our knowledge, our training, our course is helping to introduce good healthcare system in public health. Next slide, please. Yeah. So we have, as I told you, many centers we have in all the districts. Even wherever there is a place, we conduct yoga program, antenatal care, and bedside care. When the patient is admitted 1 week before the delivery, during that time, making them, ready for the delivery. First of all, the mental health, their fear, then physical activity, the breathing exercise, few asanas, which can help pelvic floor, as you know, that muscles, the pelvic bone expansion, all those things will be properly observed and trained. Not only pregnant mothers, maternity ward patients, at the simultaneously, we are also training nurses. The beauty is, nurses are the most powerful healthcare providers. They are the maximum with the patients. Time, almost maximum time, the nurses are spending with the patients. So what we thought is, the nurses community should be reoriented with yoga naturopathy, and we have started giving training for them. See, if you want any successful public health, we need to coordinate, we need to make them aware, we need to tell them what we are doing, what is our science, what we can do. So if they learn, if they are oriented, then they will tell the pregnant mothers, they will tell NCD patients, they will tell all others. So we have started intensive training, that is yoga naturopathy training for village health nurses. Each village, we have village health nurses who takes care of that village. So we thought, if every VHN, village health nurse, if she knows about our yoga naturopathy system, then she can spread the awareness among the village people, among the patients. Based on that, we have created a module, public health training module for village health nurses about yoga naturopathy, and we have conducted 3 days training program. 3 days intensive training, only yoga naturopathy from morning to evening. 3 days that includes yoga training, dietary preparations, dietary training, and all other small, the treatments what we give to patients. So that training has given very good result in 2 ways. One is, it has created best awareness among the public health and patients. And another issue in Tamil Nadu, what we found is, every VHN, when she goes to village, when she meets family members, she is able to tell about the system of yoga naturopathy, and she practices herself for her own health. We have got feedback, lot of feedback from VHN, where we could able to, and they are able to explain about BNOS course in each village. That's what we are very successful for admitting patients. Almost now all the medical colleges, that Tamil Nadu has got almost 19 yoga naturopathy medical colleges, which offers BNOS medical degree course. Next slide, please. Next slide. Yes, this is also all nurses program where our BNOS doctors gives. Next slide. So this is the medical college training where we give treatments. And next slide. This is the, see, another training program for our medical officers, allopathic medical officers, block medical officers, and NCD staff. We have, non-communicable disease NCD clinics. So there also we have created the awareness. Next slide. So this is the first trimester. Next slide. Second trimester for third trimester. Next slide. So these are the dietary. See, everything is documented. Everything is documented, and it is a ready-made, program, a tailor-made program. We have designed the diet, model diet. Of course, patient to patient, slight variation will be there. That is the specialty of our yoga naturopathy doctor who can guide. Next slide, please. This is for diabetes mellitus, hypertension, obesity, all NCDs. Next slide, please. So this is the diet module. See, now I am coming to important area. Next slide. Now I am coming to important area. See, we were talking about, non-communicable diseases, lifestyle disorders. Yes, everything counts now. More than that, now today is a pandemic situation where everybody is afraid of COVID and the suffering is more. So based on this, Yoga Naturopathy System of Medicine has ventured into COVID care activities. Next slide, please. So this is the development which in public health. See, the public health covers entire communicable and non-communicable diseases. So we have entered into this area, COVID communicable, the thing. So this last March 2020, we were the first people to design the module guideline, and we have submitted to all directorates and Government of India, and with the help of all our doctors. Almost 200 yoga naturopathy doctors have screened it, have gone through that, and 20 senior doctors. Next slide, please. So this is a government order. See, anything we need a protocol, and a government order which issued yoga naturopathy prevention and management. Next slide, please. So this is our yoga naturopathy for communicable diseases, especially COVID management. We are giving to the patients. See here, live, real time, any center you go, COVID care hospital, COVID care center, multi-super specialty hospital, there our BNYS doctor is inside the ward, and he gives the intervention with the help of therapists, and he gives the treatments. So these are the few modules which we are giving the treatments. You can please go through that. Next slide, please. So target group, yes, we have covered entire population. That is the general public, quarantine people, migrated laborers, and COVID positive patients, that is asymptomatic patients, symptomatic, mild symptomatic, moderate symptomatic, and sometimes our doctors have entered the ICU ward where patients are serious, but that time they are giving the yoga naturopathy intervention to make up their mind makeup, breathing technique, and all those things. Next slide, please. Next slide. Next. Yes, in the year 2020, first wave, we had 180 COVID care hospitals and centers. And in now, second wave, which started in the April, May, now June, we have 184 COVID care hospital and center. And this time we have dedicated exclusive yoga naturopathy COVID care center. The beauty is yoga naturopathy COVID care center, yoga naturopathy doctors are posted 3 shift, 24 hours. Our yoga naturopathy intervention is given and patients are getting admitted and they are discharged happily, healthy way without much any complications. So we have 174 integration with allopathic and 10 yoga naturopathy COVID care centers. Next slide. So this is the research activities. So almost we have published 3 papers, publications, and 2 papers accepted, and it is being submitted. Another 5 projects are going on, and it will come up. It will come. Now result has come up very nicely, and along with yoga naturopathy, the result is very encouraging, and patients are happy about it. Next slide. So this is the research publication, latest research publication. You can go through that in anxiety, depression, and I think this is the first paper internationally, first time for COVID. Next slide, please. So this is another research paper where you have COVID patients, public health. Next slide, please. And this is iridologist, iris diagnosis. See where we in BNYS goes, we study iridology. Now we want to prove it. Yes, it is a well documented, well scientific. This paper has proved it, and we are going for advanced research. And earlier slide, which one research paper was published on public health. The public health we could able to cover the intervention, in public health program. So we NCD, we have documented it. Next slide, please. Yeah, this is the Tangapalam Yoga Naturopathy Medical College, Vasudeva Nallur, and Annai Velangani College for Women, Saidapet, Chennai. This is exclusive our Yoga Naturopathy COVID Care Center. Starting from morning, giving the neem and turmeric paste and giving immune booster and giving yoga therapy, steam inhalation, acupressure, acupuncture, and all other our natural medicine and treatments. Next slide, please. Next slide. Yeah, these are our interventions. Next slide. So these are the various activities. Our doctors will have awareness camps, distribution of immune booster. The immune booster which we have created. See, naturopathy uses natural medicines. All along the history says the natural food, natural herbs. So that we have to use as natural form. See, the medicine which is come from nature, without adulteration, without modification, in natural form, it gives the best effect with no side effect. So based on that, we have designed all this module, treatments and combinations. Next slide. This is a screening. Our BNYS doctor goes for screening and they find out the positive patients. Next slide. This is a special camp for migrant workers. See, the BT was when last year, there was a lot of migrant workers from other states. They want to travel, they want to go back to their state. In between, they had very panic. The entire family was in panic. So we could able to arrange them, the staying, and we could arrange them yoga program, our natural health program, to bring down their stress level and making them calm until they reach their safer place, their home. Next slide, please. So this is a quarantine home. So our doctors visit even house quarantine people. Next slide. Yes, next slide. Yeah, this is the isolation wards. We have COVID positive patients kept in isolation ward. There is COVID care center where we have very beautiful yoga hall and all other treatment places where our doctors will attend the patients. Next slide. This is the steam inhalation. The beauty of steam inhalation is we have introduced steam inhalation mechanized way, and the patients feel much better because it acts on scientific method. As you know, it clears the air passage and it bring down the inflammatory changes, and also the expansion of alveoli will be much better so that he can inhale more, and oxygen saturation also will increases. Next slide. Next slide. So this is the supplement, like amla, we used to give amla fruits, juices, and treatments and herbs. See, our BNOS degree course, medical degree course, long back in Tamil Nadu, Dr. MGR Medical University, almost 20 years back, before, we could, first time in India, their syllabus was so comprehensive, where our doctor will be entirely 360 degree angle, he'll be able to treat the patients. So we have introduced so many subjects 20 years back itself, that herbology, nutrition, pharmacology, minor surgery, emergency medicine, all these subjects has helped now during this pandemic situation, where our BNYS doctors are able to give full-fledged, comprehensive, holistic approach to the patients. Next slide. See here beautifully, as you know, today COVID patients need vitamin D, because there are a lot of research papers has proved that vitamin D deficiency is leading to a lot of complications. COVID patients, inflammatory changes are very fast. So their resistance is coming down, immunity is coming down. So for them, yoga as well as sunbath, heliotherapy, where they'll get both the benefits, vitamin D as well as yoga, practice of yoga benefits. Next slide. Next slide. Yes. See here, pregnant ladies. See now what happened is pregnant ladies also becoming positive. So until delivery and postnatal care, we need to take care of them. So we have an Institute of Obstetric Gynecology where our yoga and naturopathy BNOS doctors are employed there, appointed there. So they are taking care of positive pregnant ladies. Next slide. So as I told you, we need to take care of our own medical fraternity. So we have started providing healthcare to healthcare providers. So that is the treating the doctors. So all positive doctors, allopathic doctors, nurses, healthcare staff, workers, whoever become positive, they are being admitted in the hospital. Special care was given to them. All our yoga naturopathy treatments were introduced them, and they was very happy, and acceptability was very high. And the feedback given by the pulmonologist, anesthetist, general medicine doctors is amazing. We have a feedback that they given their own statement with their own voice. They appreciated our yoga naturopathy doctors, yoga naturopathy treatment. So at last, they were convinced because they have experienced personally. So until unless yoga naturopathy, the personal experience speaks a lot. That is more important. So we could catch them, we could able to give them treatment. Now they promote. Now they are telling that patients, okay, do yoga, do breathing, take steam inhalation, take this immuno booster, take this acupressure, like that. So that is the secret of success. So we all BNOS doctors, I request, please try to convince the medical fraternity, give them treatment, let them experience. If it is the best, let them tell others. It cannot be worst. Yoga naturopathy never fails if it is done properly with under the supervision of qualified yoga naturopathy doctors. Next slide, please. So at last, I would like to say we are fortunate. We are fortunate to be in family of yoga naturopathy, and we are fortunate that we have studied yoga naturopathy. That has given now this COVID time. This COVID time has given importance for our system and our doctors and our own doctors taking care of health through our yoga naturopathy. So that's what I said. Yes, be with yoga and naturopathy, and be from illness and hospital. So that's what I have always read one quotation that all over the doctor one I was seen in WhatsApp. One should have fortunate to have association with yoga naturopathy doctor. That is a true, 100% true. And in public health, we can play major role. And integration with allopathy hospitals, our yoga naturopathy doctor can play a major role because we don't give chemical drug. We don't give any chemical drug. So it can go along with any system of medicine, especially allopathy. Integration with yoga naturopathy can do successfully in public healthcare system, which is already proved, already is being practiced, and already well documented. So only thing is we need to empower. We need to have that commitment. We need to have that willpower to enter into the public healthcare system and try to reach the people, grassroots level. Then we will be able to success. Definitely, we are doing the best work all over India. Yes, I remember the entire India, our BNYS doctors are doing excellent work in all colleges. And time will come where this will be the best medicine in this world and India. As Gandhiji said very clearly, every village needs one yoga and nature center. Every village. That is a Gandhiji vision. Long back, about 70 years back, 80 years back. Now his vision is being fulfilled. It should be fulfilled with the help of our own doctors, reaching to the government policy, approaching the government, telling them, explaining them, ready to service, ready to serve in public health, so that we'll be able to successful. So I hope I have given a glimpse, a few basic our activities, what is happening in Tamil Nadu. So I must be very thankful to our government of Tamil Nadu for supporting us. Without their help, we cannot do anything. So this is the occasion where I must thank our government of Tamil Nadu for supporting us, promoting us, and reaching to the people and providing the best healthcare services. So thank you very much for giving me this opportunity. I must thank our organizers of this conference and college management and all other associated people for disseminating this knowledge, this message. So thank you very much.
Thank you, sir, for your very informative session. Actually, we are really happy to know how great work is going on in the field of naturopathy and yoga in Tamil Nadu. And even we are inspired that through naturopathy and yogic approach, we can move to the other streams like maternity and pregnancy. So thank you, sir, for your invaluable time and your insight how we can move into the public health.
Thank you. Thank you very much. Thank you.
Moving ahead to our next speaker, we have a very renowned personality. You can say internationally renowned personality from UK, Dr. Peter Haggard, a licensed psychotherapist. He's trained in the body-oriented therapies as well as hypnosis and cognitive behavioral therapy through schema therapy. He started an adult education called 1 Year in Transition, linking the external environmental challenges with inner personal dimensions, both in personal and planetary health, based on eco-psychology and partly from his film work in India. He wrote his thesis on synchronicities in the therapeutic connection and believes in the need to explore how a society could be based more on connection than consumption. I welcome you, sir. Today, he'll be enlightening us on nature-assisted therapies and sense of meaning.
Thank you very much.
Haggard.
And greetings from Stockholm. Actually, I normally live outside on a farm and work basically from there, but now I'm in an apartment in Stockholm. So I want to try to share also my presentation, and I have to just see how that works. Unfortunately, I was not able to give that, so I have to find the presentation here and be able to share it. I hope that you are able to see it now.
Not yet, sir.
Okay, we see this. I start my video again, and I should. Do you see anything now?
Yes, video is on, sir.
Video is on, sir.
Yeah,
Yes.
but do you see the presentation also?
No.
Not yet.
So it's a bit odd because I have to find it. See how I can do that. No, so that's no. Well, in that case, I will send the presentation, and then I will actually send it in later, and I will just speak from it now. So I'm sorry that the technical problems. So I will start talking a little about how I came to do this work and my connection to India. And there was actually some years ago, in the end of the 90s, I made a film called Sambandha. It's a film about the struggles around the Narmada dams. And out of that, a friend that I got to know and was participating in the film was Satyanath Sarangi. Later on, he made the Sambandha clinic in Bhopal. So I got a very nice picture from the clinic I just found today. And that was the connection, and also gave me a lot of inspirations from India. And another inspiration I got from India at that time, when I was working as a filmmaker and a journalist, was meeting the Professor Raini Kothari. He wrote the book Rethinking Development in Search of Human Alternatives. And I was able to meet and interview him, and especially the criticism about Western models of development really caught on me, and realizing that we in the West actually have to look for new paths, because the kind of sense of richness we have on a material level, at least in Sweden for some time, also made us deprived of spiritual connections. And we see now that we have actually a huge amount of depression, especially around young women. So this is area that I was working on the individual level. But lately also I've started an education where we are picking up people with many of these with this kind of problems. And it's so sad that I can't share this because there is a model that is called the Theory U, Leading from the Emerging Future. And its subtitle is From Ecosystem to Ecosystem Economy. So it's a whole model that you can take a look on when you see the pictures later. Then coming into nature-assisted therapy, yes, in Sweden, we've had very much emphasis on clinical work, on the medical, and obviously not on things like yoga, because that has been regarded as alternative medicine. So lately, mindfulness and also nature-assisted therapy has come into the field of medicine. And it's partly through the Agriculture University, where they also made research on stress relief. And we could really see the effect of being in nature, especially in combination with the therapy. So I have a quotation there: humans have long interacted with the natural world, from foraging and hunting for food to finding solace and peace in the nature. Our connection runs in our DNA. And now, especially in a cold country like Sweden, we spend over 90% of our times indoor. And that obviously doesn't fit us as biological beings. So having worked with this for about 20 years on a collective or an individual level as a therapist, I also then found that it's necessary to take one step further. And the inspiration of the transition movement gave me led to a model that a woman called Joanna Macy has started. And it's also a question about where we are in modern society, that of environmental reasons, we see that we have to make a shift. That means we can't have eternal growth. That means that we have to shift in looking inside. And that method she calls active hope. That is, we can't just sit back and wait for hope. We have to be active to find hope. That is creating alternatives. And that connects also what the Professor Kothari was writing already in 1980. He said very wisely that in the future, politicians will not be able to handle complexity. They will then leave the power to technocrats. Neither they will be able to handle that complexity. That means that autocrats, once again, are likely to resume power. So what we have to do is build local communities, nature-based, bottom-up communities, and also Gandhiji-inspired, and connect them all over the world. And that is the sort of direction that also Joanna Macy is pointing out. So she made her PhD work on complexity studies, and she could see the connection also with Buddhist philosophy as she was living in Dharamsala. And through that, she created a lot of embodied education. So with that inspiration and with the course from Schumacher College called 1 Year in Transition, we started a similar education for adults in Sweden. And here I have a very beautiful Swedish nature picture that I'm so sorry that you can't look at, but I will certainly share. And that it's a beautiful lake, and looking out at that, my question, if you could just maybe close your eyes and have the sense of looking out in what you really find is the most beautiful nature. And the question is, what can nature tell you? What message does nature have and brings to you? And how could you interact and find your way of interacting with nature? So that is part of the nature-based therapy that we are working on. And with the education, we also use this model that I mentioned before, the theory U. And once again, we have a really nice pedagogic picture. But the idea of that is that we, by trying to open our mind, open heart, and open will, we come to a point where we maybe, it's in this model called pre-sensing or creating presence, that is also being open for what is to come, not exactly what we are directing. This is a model we use in our education, and it has turned out that the people, I think so far 100 people, we made a scientific study now recently, and people were really reporting that this kind of education has changed their life, and they feel in a way connected. So my aspiration there is that not working on the individual level, but also trying to find a collective level, and then being able to be more resilient. And the word resilience is very much a key word in these days. Another model that I want to share, and which is crazy that I can't, but it's about Ken Wilber, a model of a right side. If you imagine a quadrant, on the right side, you have the interobjective. This is the field where, for instance, politicians make laws. In Sweden, one good example, there are many bad examples, but one good example is that we have CO2 taxation. And by having a CO2 taxation, it means that people are likely to, for instance, get a vehicle which consumes less CO2. So that these areas are both then the objective, interobjective, and the objective personal. That is areas where you could study and measure. But on the left side in this model, we have the subjective. This is where we go into inner therapy. And this is the area where we don't really know what makes the shift. What is the connection between the therapist and the patient, and what makes he or she realize that he has to be master of his own life. That connection is very difficult to study. Maybe in afterwards we can see what it was, but to understand that head is very difficult. And then on the intersubjective level, on the left side down, we have a situation where we have paradigm shift. And one example that you may have heard of is Greta from Sweden. I would say that had I been sitting outside the Swedish parliament, no one would have taken notice. But at that time, this young woman was sitting outside with the protest, and that made a shift that actually has inspired the world movement to be more conscious about the environment. And what we are trying to do with our education, but also with that understanding to see how people can see that their own inner feelings is also part of a collective feeling. For instance, this sense of actually having mental problems now, it's not only a private burden, it's actually something that is rather natural in the situation where we are in the deep not knowing about the planetary future. So a bad joke would be that the person who doesn't feel crazy today have to go to a psychiatrist. That is, we have to find ways where we could self-empower each other. So I will then, after that, also share some links with you about the connections. And I quote, an end quote that I have is from T.S. Eliot: "We shall not cease from exploration, and at the end of our exploring, we will be able to arrive where we started and know the place for the first time." So this is the presentation that I will send, and I'm really sorry that you couldn't see it, but what I would conclude is that I think that the inspiration that we've had from, for instance, yoga and Indian medicine, we can see that in a country like Sweden, which is very much cognitive minded, we see that so many people, young people, are traveling and trying to find another path, another inspiration. And I think that it's a very good thing that we share and get the inputs from other countries like India. But it's even more important these days that we in the West can really look at the path, and partly the destructive path that we have created, and see that the mental problems we now face here are not only on the individual but a collective level, and in a way make a little relief from people, so that they see that they can find their inner connection. So that is what I would like to conclude with, and I will pass on my PowerPoint, and I hope that you can share it later on. Thank you very much.
Thank you, sir. You beautifully explained that how we have to connect to the nature, and we have to work in connection with nature. It's definitely our prior duty to keep healthy ourselves as well as nature, because they are two-way link. If we are healthy, we can keep healthy nature. If nature is healthy, automatically we'll also become healthy. Thank you, sir, for your great effort to give us your time and your very informative session. Once again, thank you, sir.
Thank you. Nice to meet you.
Same here. Now, to move ahead, we'll take a short break of 10 minutes. And then we'll go ahead with our next speaker. We'll return back in 10 minutes.
Good evening, sir. 2 minutes. We are just setting it.
Good evening, sir. We welcome you.
Thank you. Good evening.
So to move ahead, it's known that yoga is not just a workout. It's about working on yourself. It adds years to your life and life to your years. And this means a lot in this COVID times. To enlighten us more on this, we have our speaker amongst us, the distinguished personality and the master in the field of yoga, Dr. Satbir Singh. He's doctor. Currently, he's serving as Assistant Professor of Medicine, Harvard Medical College, PhD, Director of Yoga Research for Yoga Alliances and Kundalini Research Institute, Research Affiliate of Osho Center for Integrative Medicine. He has conducted researches in yoga for almost 20 years and has been practitioner, instructor of Kundalini Yoga for almost 50 years. He's a medical editor of Harvard Medical School's Special Report, Introduction to Yoga, Chief Editor, Medical Textbook, Principles of Yoga in Healthcare, Editor-in-Chief, International Journal of Yoga Therapy. Today, we are blessed to have you, sir, and we welcome you wholeheartedly. Today, he'll be enlightening us on yoga for COVID-19 and its consequences, science and research. Dr. Satbir Singh Khalsa.
Well, thank you very much for that kind introduction, and thank you for the invitation to present at this very worthwhile conference. So just by way of administration, how long did you want me to present? At what time?
So 25 minutes to 30
Okay,
minutes.
very good. Okay, so my topic is really focused on the science and research behind yoga and how yoga has a potential impact from this science and research relevant to COVID-19. So let me start by talking about the psychophysiology of yoga. We have, over the past few decades, a significant amount of research that's been conducted in this field. And this has led to a number of review papers that really summarize this work in this very rapidly growing body of research. In fact, we have published this book, The Principles and Practice of Yoga in Healthcare, which is available in India. And in a chapter called Research on the Psychophysiology of Yoga, we have summarized a lot of the research that has been done on yoga to give us an understanding of how yoga works on the mind and on the body, the specific mechanisms that are involved. And we can summarize these mechanisms and how yoga works in a logic model. And this is the logic model that we published in this book. Yoga practices as it is mostly practiced in the general population. Traditional yoga really incorporates not just the postures and the exercises or the asanas, but it also includes the breathing practices or the pranayama, the practice of deep relaxation, and very importantly, the meditative component of yoga practice. Now, we can conceptualize the effects of these in a number of different realms of psychophysiology, as indicated in these boxes here. Now, it's through all four of these practices, whether they're combined or independently, that have an impact on the body. And this is this box I'm calling the effect on the physical body or fitness. We can see, and we have very strong research showing effects on the improvements in flexibility, in body strength, muscular strength, coordination, balance, respiratory function. which leads to an overall self-efficacy of the body and then through the mind-body connection of the mind itself. Now, it is also through all four of these practices, either together in traditional yoga or even independently, you can improve self-regulation of internal state, both physical and psychological. And the most important self-regulation that we see with respect to life and behavior with respect to yoga is improvements in stress and emotion regulation. These are some of the most powerful effects of yoga practice. And these are extremely important in terms of day-to-day functioning, but they're also important as improvements in areas that are relevant to the development of different diseases. Many diseases have a very strong stress component. Over time with practice, we have very strong research that shows that this stress and emotion regulation turns into the skills and characteristics of resilience to stress and equanimity in the ups and downs of emotions day to day. And overall, this self-regulation leads to a psychological self-efficacy. Now, it's largely through the meditative component of yoga practice that we see improvements in what we call mind-body awareness. Through the focus of attention in the act of meditation, we engage the attention networks of the brain. And as this continues with regular practice, we become better at maintaining our attention. And this leads to an increased sensitivity of our focus of attention. We become more sensitive to our thought processes, and we become more aware and also more mindful. And so we now have good evidence that yoga practices do increase levels of mind-body awareness and mindfulness. This engagement of the attention networks improves our cognitive functioning and our concentration ability. And over time, individuals that practice yoga regularly develop a different relationship to their thought processes. And we call this metacognition, the realization and understanding that although we have thought processes, we are not those thoughts. We have the ability to self-regulate those thought processes. And then finally, it's also through the meditative component, and typically over more regular practice of months and years, we achieve these deeper states in meditation, these unitive states, experiences of transcendence, the flow state, which leads many people to a deeper transformation, a change and an improvement in life meaning and purpose. And I'm calling this box pure spirituality. One thing you can see from this model is we're making changes across a broad spectrum from muscle and connective tissue to the deepest experiences that humans can have. And all of these factors are really interrelated. This is through the mind-body connection, through all of these functions are interactive. And we have very, very strong research on this physical component. And over the past few decades with neuroimaging, molecular biology, biochemistry, we have very strong now evidence of the development of how these processes of self-regulation of internal state and mind-body awareness or mindfulness are generated. Because of this broad spectrum of changes over many different human functions, we see changes in global human functionality with yoga. This includes physical and mental health and performance, deeper skills of stress and emotion regulation, improvements in awareness and mindfulness, and the development of metacognition, and ultimately deeper experiences, improvements in positive behavior, well-being, life values, life purpose and meaning, and even spirituality. Now, relevant to COVID, one can easily see where some of these factors can come into play. The role in in stress regulation and emotion regulation can alternatively also have impact on immune function. The increase in attention and awareness allows us to change our behaviors appropriately, to adjust our behaviors to the pandemic. The physical fitness keeps our body strong and strengthens the immune function. Now, in terms of this, we know, of course, what's going on with the pandemic, and we know very well that the pandemic is generating a significant amount of impact on psychological factors such as stress. And in this review paper published in 2021, it concludes that regardless of gender, group, or region, the current pandemic is impacting the mental health of affected populations. Indeed, all groups have a high prevalence of depression, anxiety, insomnia, post-traumatic stress disorder, and psychological distress. And in a review paper of other studies, this paper pooled 65 studies involving 97,000 healthcare workers across 21 countries. The pooled prevalence of depression in these healthcare workers was 21%, anxiety 22%, and post-traumatic stress disorder 21%. So healthcare workers are particularly negatively impacted. The systematic review and meta-analysis has identified a high prevalence of moderate depression, anxiety, and PTSD among healthcare workers during the COVID-19 pandemic. Appropriate support is urgently needed. So now I want to share with you a specific sort of rationale for COVID. And one of these factors is also applied to another phenomenon, which is long COVID, the consequences of having experienced the COVID and then experiencing consequences subsequent to that. This review paper summarized the many, many different factors that are negatively impacted with the COVID over the long term, even after the virus itself has been passed. And these include a number of psychological factors, and this includes things like anxiety and depression, sleep, memory loss, attention disorder, and a number of other physical symptoms. So let's look at some of these in terms of how yoga can have a potential impact and where yoga has improvement capabilities. One of these is yoga for stress, and this is probably one of the most powerful areas in which yoga can make a positive benefit. In fact, we know that it is one of the major reasons why people come to yoga practice. In this survey study we conducted in the United States, we showed that stress management was one of the major reasons that beginners yoga practitioners were coming to yoga practice. In fact, in that same group of yoga young individuals who were coming to yoga, we saw a reduction in perceived stress from before the beginner's program to after the beginner's yoga program. Other survey studies have shown similar phenomenon. Furthermore, in this study that was recently published in the UK, again, stress was one of the reasons that was used initially for the practice of yoga in this orange bar here. But what was interesting was this was a survey of people who had already been practicing yoga for some time. And what you can see is that although only 5% of practitioners use stress as the reason for initially practicing yoga, that rose to almost 20% of practitioners who are now claiming that stress was a reason for them to continue yoga practice, suggesting that many people came to yoga for other reasons, but they found and experienced that stress was really effective in terms of its mediation through yoga practice. Another survey study has also shown us that yoga practitioners perceive yoga as very good for psychological states such as stress and anxiety. 98%, 97% find that yoga is helpful for stress and anxiety, and it's also helpful for sleep issues as well as depression. We also have, as I've mentioned, a good body of research that has documented the improvements in stress with yoga practice. This review paper in 2020 concluded that most types of yoga have positive effects on stress reduction in healthy populations. And although many of those studies are done with psychological surveys of perceived stress, we also have good evidence that this can be measured from objective measures of stress. So this review paper summarized reductions in the stress hormone cortisol, systolic blood pressure, resting heart rate, high frequency heart rate variability, blood glucose, and blood lipids, and showing that yoga improves regulation of the sympathetic nervous system and the hypothalamic pituitary adrenal system, both systems which are manifesting the stress response in humans. Just to show you some evidence from our own research in our laboratory, we've done studies on yoga in workplace populations. This was a study done with a yoga program, a randomized controlled trial in education professionals, many of whom were teachers, a highly stressful profession. And we measured perceived stress, and as you can see at the baseline, the yoga group is in the black bar, and the control condition is in the gray bar. They are equivalent at baseline in perceived stress. After the yoga intervention, we see a reduction in perceived stress that is maintained at the long-term follow-up, statistically significant reduction compared to the control condition, which did not reduce stress. In terms of resilience to stress, we see a similar improvement. The yoga is increasing and is higher at the long-term follow-up, whereas the control group had no changes in resilience to stress. Now, another impact that I mentioned in looking at the psychophysiology of yoga was improvements in immune function. And this stems largely from the relationship between stress mechanisms and immune mechanisms. So this review paper really summarizes this whole field of research, which has been called psychoneuroimmunology. And what you can see from this model here is that the outputs of stress, which include the stress hormones cortisol, epinephrine, and norepinephrine, have a negative impact on immune function. So that what we can see here is that if we engage in yoga practices which are able to calm these stress systems down and reduce the levels of cortisol and norepinephrine, we can then release that inhibition to allow immune function to function properly. And we actually have evidence that this is the case. So this is a review paper summarizing the effects of yoga on immune system functioning, concluding that there is benefit on immune function, not only on immune function, but also in improving inflammation, which is an immune response. This is a specific study that was done, and in this study, they looked at the levels of cortisol in a randomized controlled trial. And what you can see in the control group in this condition is that the control group shows an increase in the levels of cortisol, whereas the yoga group maintains the same levels. And then also there's a greater reduction in adrenaline with the yoga practice than there is with the control condition. They also measured cytokines, and these are IL-2, and we can see that the yoga group shows an improvement in this immune function marker, showing improvement in immunity, and the same is true if in IFN. You can see the yoga group shows an increase in this immune marker. These results suggest that yoga is improving immunity. In another study looking at older adults, this was also a randomized controlled trial, and they were looking at, in this study, immunoglobulin A results. And what we can see in the control condition is no change, but in the yoga group, we can see an improvement in the values of this particular immune function metric. And this is concentration, this is secretion rate. You can see increases in both of these. Finally, in a study that was done with a yoga meditation practice in highly stressed individuals, looking at transcription factors, we see the suppression of the expression of inflammation-related genes and the upregulated expression of genes involved in antiviral and immunoglobulin responses. So this is important because this tells us that we can see not only the improvement in immune function, which is going to enable resistance to infectious diseases such as COVID-19, but it can also help in terms of inflammation. And we know that there's a whole idea of the cytokine storm associated with COVID-19 and its reaction. So yoga provides this particular benefit of not only improving immunity, but also reducing inflammation. This idea of burnout in healthcare professionals was a phenomenon that was in place well before the COVID epidemic. In fact, this review paper in the United States from the Harvard School of Public Health concluded that the prevalence of physician burnout has reached critical levels. Recent evidence indicates that nearly half of all physicians experience burnout in some form, and it appears to be getting worse. So this is a serious problem in the healthcare system, and this is not just in the United States. This is a problem that is occurring internationally. In fact, there's also a paper that shows that there are high burnout levels uniformly recorded for the entire population in a study of questionnaire-based study of medical practitioners across India. And these results are all from studies that were done before the pandemic. And so as you can imagine, the pandemic itself has exacerbated that situation substantially to increase stress and burnout significantly. And we do have evidence that yoga is effective for healthcare workers in the reduction of burnout. So this is a recently published review paper that concluded that yoga appears to be effective in the management of stress in healthcare workers. And I can share with you some of the recent studies that we've done on yoga in healthcare workers. And this was a study we conducted at Brigham and Women's Hospital, which is a Harvard-affiliated hospital. These are Harvard physicians in obstetrics and gynecology in the neonatal intensive care unit. We went into the hospital and gave them a 6-week intervention of yoga practices. We measured total burnout from the Professional Fulfillment Index. This is the baseline score, and what we can see is at the end of the program, the scores on burnout were statistically significantly reduced, and those levels were maintained at the 2-month long-term follow-up. On subscales of this burnout instrument, we also saw reductions in work exhaustion, reductions on interpersonal disengagement, and improvements in professional fulfillment. We also saw reductions in perceived stress in these physicians, improvements in resilience to stress, and actual improvements in mind-body awareness or mindfulness with the yoga practice, improvements which were maintained at the long-term follow-up. In addition to this, we also did an additional study on resident physicians who, if anything, are even more stressed than actual physicians themselves. This was a randomized controlled trial, and we can see total burnout scores reduced in the yoga group in the black bars, maintained at the long-term follow-up. The controls had no change in burnout score. We also saw improvements in work exhaustion, improvements in physician well-being, and also improvements in interpersonal disengagement. In this same study, we also showed reductions in perceived stress in these residents, improvements in resilience to stress, at least at the end of the treatment program, and improvements in mindfulness or mind-body awareness that were maintained at the long-term follow-up. Now, I want to address another yoga practice that I did not include in the logic model, and this is a yoga practice that many people who adopt a yoga lifestyle will practice. This is called Jalaneti, which is the practice of nasal irrigation with salt water. And this is a cleansing practice within yoga that's well known in yoga practices and has a long history of practice within yoga. Recently, this review paper was published, and it concluded the technique of nasopharyngeal wash to prevent the virus, and this is any virus, from inhabiting and replicating in the nasal and pharyngeal mucosa, has been suggested to be useful in reducing symptoms, transmission, and viral shedding in cases of viral acute respiratory tract infections. In fact, there are a number of review papers suggesting that this yogic Jalaneti practice can actually improve problems in the nasal mucosa. In rapid systematic review, we found studies showing some improvement in prevention and treatment of upper respiratory tract infections. And of course, COVID-19 is an upper respiratory tract infection. In fact, a study was done by Sandeep Ramalingam in the UK showing that the practice of Jalaneti could reduce the severity and duration of cold viruses. And then in a subsequent study, looking at a subset of coronaviruses within that population of cold viruses, they did an analysis that showed significantly reduced cold symptom durations in Jalaneti compared to control subjects in a randomized controlled trial. What they found was that the duration of illness was reduced by 2.6 days. The symptom of blocked nose was reduced in duration by 3.1 days, and the reduction of cough by 3.3 days, and the reduction of hoarseness of voice reduced by 2.9 days. So in this study, which tells us that coronaviruses are affected by Jalaneti practice, this is very strong evidence that suggests that this may be useful. Now, this paper was published last year in 2020, and subsequent to that time, there have been a number of review papers which have also promoted the idea of Jalaneti practice for COVID-19. And in fact, there is one study that has actually done this on COVID-19. These are preliminary data from a randomized controlled trial. And in this study, they had a group which had no intervention and a group which had hypertonic saline and one with saline plus surfactant. So just comparing the green with the blue, which is the no intervention, with the hypertonic saline in Jalaneti practice, you can see that on cough, that the blue curve is trending towards much less duration over time than the no intervention group. The same is true for nasal congestion. You can see the differences in terms of the headache and also in terms of fatigue. And summarizing this from this paper, in non-hospitalized patients with COVID-19, the effect of nasal irrigation on symptom resolution was substantial, with nasal congestion and headache resolving a median of 7 to 9 days earlier in the intervention groups. Our analysis suggests that nasal irrigations may shorten symptom duration and may have potential as a widely available and inexpensive intervention to reduce disease burden among those affected. So I am working very closely with the International Association of Yoga Therapists, which supports some of our work. This is a leading yoga therapy organization in the United States, and they support the Symposium on Yoga Research, which I help coordinate. This year's symposium is happening on November 15th to 16th. It is open to all scientists who are interested in research on yoga. I also work with the Kundalini Research Institute as their director of research. This supports the style of yoga that I practice. And I also am the director of yoga research for the Yoga Alliance, and my role in that organization is research literacy. So on our free access websites, you can find yoga research videos professionally produced, over 3 dozen yoga research webinars that are free access. These have all been recorded, and also a collection of citations in various different fields of yoga research that make it very easy for individuals to access the research that's been published on yoga. So I thank you for your attention, and I'm happy to take any questions if there should be time.
Thank you, sir. Here are a few of the questions. What practice or intervention was used as yoga, pranayama, or asanas for Harvard study, which was conducted health?
So this was a study of a style of yoga called Kripalu Yoga, which is very popular in the United States. This is a traditional yoga style that includes asanas, pranayama, deep relaxation, and meditative components. They also added a good deal of mindfulness practices in this intervention. And it was a 6-week intervention. It was specifically targeted for occupational settings, but it was all of the traditional hatha yoga practices that you could see. And it was a very comprehensive practice.
The next is how to convince a patient to adopt yoga post-COVID times. Like if the person has been already infected, after that, the person is very weak. So how to convince that person to go for yoga, or what easiest exercises or techniques we can give them?
Well, the most simple techniques are very simple meditation and slow yogic breathing. Those two practices can be done sitting in a chair. I mean, you don't have to do fancy, complicated asanas. If you do meditation with slow breathing, you have enormous benefit from that. If you can get the patient to do some simple loosening exercises that we call in yoga, some simple stretches, some simple spinal flexing, some simple body extensions, what we call chair yoga, even that can be helpful. But the best strategy, of course, is to try and get the patients to attend with a yoga teacher, because then there can be proper instruction and proper practice. These days, with the COVID epidemic, many yoga teachers are actually teaching online, so there are many opportunities online. So, for example, there are even government agencies that are involved in providing this. Ayush, which is the Indian government's agency for supporting research on yoga and complementary medicines, has resources. The Morarji Desai National Institute of Yoga, based in Delhi, has videos and opportunities to educate the public about the practice of yoga. And yoga is very popular in India, so finding a yoga teacher is not that difficult. And it's important to find the appropriate yoga teacher so that the person who is practicing yoga has a good experience. Because if one practices a technique that is too difficult or too easy, then the patient will not engage in the practice. So it's very important to tailor the yoga practice to the patient so that the patient will engage in the practice.
Okay, sir. What is Kripalu Yoga?
Swami Kripalu was an Indian yoga master who came to the United States and began teaching his style of yoga. In the United States, we have many different styles of yoga that were brought to the United States by different teachers. Some of you are probably familiar with Iyengar yoga. Iyengar yoga is probably one of the most popular forms of yoga in the United States, but there are other forms of yoga. Integral yoga was brought by Swami Satchidananda, Shivananda yoga by Swami Shivananda's disciples. And so we have different styles of yoga. They are all basically forms of hatha yoga. They all incorporate those traditional components of yoga practice. You can find Kripalu yoga on the internet. There is the Kripalu Center for Yoga and Health, which is the largest yoga center in the United States, based in Western Massachusetts. And they offer programs for people to come to their center and do workshops. But there's a lot of information on Kripalu yoga that's available on the internet.
Okay, sir. Thank you, sir. You truly said that COVID has led to the huge psychological disturbances. And very nicely, you concised how yoga has impacted positively on the states of mind and in tranquilizing our nervous system and hormonal levels. So we are very thankful for enlightening us with your precious words on COVID, how to manage it. And you enlisted how people have got impacted with COVID and how it has been conquered with the help of yoga. Thank you, sir. Thank you once again.
My pleasure. Namaste.
So we are here at the end of our technical sessions of day 3, and it's time to move. And again, we'll meet tomorrow. So at the end of the day, keep your spirits high. Tomorrow is a new and a better day to learn more, to grow more, and to serve more. With this, we wish you good night. Stay safe, stay healthy. Thank you.